Starting off this semester, I had a student ask me, or in class we were discussing, but what exactly is EMS, or Emergency Medical Services? The answer sounds pretty easy. It's medical problems that are an emergency and we come out and serve them. That's EMS, Emergency Medical Services, but there's a whole lot more to EMS than just that. I think most people think EMS when they see an ambulance going down the street or they see the helicopter going overhead, and that is a lot of what we do, but we do more than just that. And when I'm asked what is EMS, I have a hard time myself describing or answering it very shortly. There are several components that have to be involved to have an EMS system. We have to have one, a public that will know when to call, when not to call, what it is an emergency, and how to do some basic first aid until the EMS gets there. We need to have some sort of communication system, and we're lucky in this country that we have 911. So anywhere in the country you can dial 911 and you'll get emergency services. You can do the cell phone, landline. Either way, we can get help there. That's pretty amazing. You call 911, you know help is on the way. You need to have the ambulances and the equipment on the ambulances, so there's all that is involved. And ambulances come in a few different sizes, that'll be another video. But they all have to have certain equipment, certain standards, meet federal regulations, and then we can call it an ambulance and put a Star of Life on it. That equipment is not cheap. It's fairly expensive. The ambulances themselves can run upwards to $150,000, and then all the equipment on it. So look at $200,000 to $225,000 to outfit, have an ambulance there. Then you need people to work on it, and typically there's crews of 2. Sometimes some places have 3, but usually there's crews of 2. So we'll have one person that'll be the driver and one person that'll be the EMT, or the patient care technician. Now, what the 2 roles are vary from service to service. Some services have basically an ambulance driver, and then they have an EMT. Some services have an EMT as the driver typically, and then a paramedic. Some services have 2 paramedics. Some services have advanced EMTs and paramedics. So we can mix it up a little bit, but usually the lower level of care is going to be the one driving, and then the higher level of care is going to be the one that's in the back of the ambulance. But you need to have at least 2 highly trained professionals to work on the ambulance. Then we also need someplace to take the patients. So we need to have emergency departments, we have specialized facilities like trauma centers, cardiac centers, stroke centers, OB hospitals, pediatric centers, burn centers, all these different types of hospitals. And one hospital may be several of them. So a lot of times the trauma center is also the burn center. They also have all the capabilities to handle cardiac patients, so they might be a cardiac facility. So sometimes hospitals have multiple designations, but we need to have these different facilities to go to. Not all communities have hospitals that have all of those centers though. So you may be taken to a local hospital or a community hospital that maybe can't handle what is wrong with the patient in its entirety. And then we'd have to take them to another hospital. So that's something else that EMS does. We will do a transfer from one hospital to another hospital. And that may involve just the local ambulance service. Or if it's something very, very sophisticated or complicated with patient care, you may have to get the critical care ambulance to come. And those are people that are typically paramedics, and they have gone on to additional training above and beyond what is normally in a paramedic curriculum to do more sophisticated, typically ventilators, pumps, invasive equipment, and be able to handle that equipment and manage that equipment from one hospital to another. Our air ambulances or helicopter EMS can usually handle those. So that's another component of EMS. And then we have all sorts of other roles that maybe aren't on the ambulance. So we have EMTs and paramedics that work in the emergency department. We have EMTs and paramedics that work search and rescue and wilderness medicine. I kind of like that stuff. Work as rangers in some of the national parks and state parks. We have them that work for sports teams. We have them that work movie set medics. I think that'd be kind of cool to do first aid for a movie set. If I ever get that, I'll get some autographs. Cruise ships, that's one that a few people are interested in doing. Go do first aid, medical care on a cruise. We have many EMTs and paramedics that work in like a factory or an industrial setting and do the first aid there. So EMS is more than just the ambulance. Now, ambulances themselves, we have different models for providing the care. I mentioned that some services have different types of crews. We have volunteer ambulance services. We have private companies that are ambulance services. We have hospital-based ambulance services. We have community-based or like a governmental type ambulance service. So maybe like the city has their own ambulance service. And each model has advantages and disadvantages. Typically in the more rural areas, they can't afford to pay EMTs and paramedics to staff the ambulance, so they rely a lot on volunteers. And that's really an amazing thing, that volunteers, somebody would take their time and their money to go through EMT or paramedic school and get the training and then maintain the training every 2 years, go through all the classes they need. And then just out of the goodness of their heart, when the tones go off, something happens, they drop whatever they're doing and go take care of their neighbor. So volunteers hold a special spot in my heart. That's an amazing thing that they do. Usually in larger cities where we have a more population, we run more calls, we can then afford to pay for the EMTs and paramedics and can justify it. So typically our middle to larger cities have more paid services. Some of those are private companies that run the ambulance service. Some of them are hospital-based. Some of them are municipal-based, and they might be part of the fire department, or they might even be what we call a third service. So if we think of law enforcement as the first service, fire department is the second service, and you can argue about which one's first or second. But then the third service that a city may manage is the ambulance service. So sometimes that's called the third service model. So there's different ways of managing the ambulance system. We have a little bit of a problem figuring out exactly where we fit in the whole system. So even though we work out of hospital typically, and we may or may not do emergency or non-emergency services, or maybe we do them both. Emergency stuff is typically the 911. Non-emergency is going to be someone has to go to dialysis, someone has to go to their doctor's office, we have to take a person from a nursing home to a facility or from a hospital home. Not an emergency, but they still need an ambulance or a stretcher to be able to lay down on and be transported. So we do that too. So dealing with emergencies and out of hospital stuff, some people want to put us into the category of emergency services and lump us in the same as police, fire, hazmat, EMS, emergency services, first responders, dispatchers too. They are fully in that group. But being that we also do medical things, and sometimes we work as outside of the ambulance, doing other jobs, maybe we should be part of the medical professional fields. So are we emergency responders, or are we part of the healthcare system? So we kind of merge those two. So we might fit a little bit with public health, we might fit a little bit with healthcare, we might fit a little bit with emergency services. Really kind of an interesting junction point between those three systems. And I think it's a really unique and cool place for us to work. So when there is an emergency and the public recognizes there's a problem, hopefully they start doing some first aid, and then someone will contact 911. 911 can then provide the people on scene with some pre-arrival instructions on how to manage the situation until help gets there. When they page out typically the fire department and the ambulance service at the same time. There are usually more firefighters, fire trucks, fire stations in a community than there are ambulances. So they can oftentimes get there before the ambulance does. So typically the fire department, first responders will respond and can get there a couple minutes before the ambulance crew does. So first responders get there first, then typically the ambulance crew gets there second. Police officers will oftentimes come to 911 medical calls just to be there, because sometimes some situations get a little hairy, so they'll be there to help. And then we work together with the first responders and the ambulance crew to manage the patient, decide what needs to be done on scene, and then we'll move the patient to the ambulance and start to take him to the hospital. And we'll go to whatever hospital the patient wants to go to. We can't kidnap him and take him somewhere else. We go to the hospital that the patient requests. Now, if the patient has a condition, like let's say a heart problem, and hospital A doesn't have the facilities to handle heart problems, but hospital B does, we will try to get them to go to hospital B. So that's the better place for them. But if they just insist that they want to go to hospital A, we will take them there. We'll probably end up transferring them from hospital A to hospital B later. This is waste a little bit of time perhaps, but we will take the patient wherever they want to go. But we want to try and be an advocate for our patient and take them to the place that's best suited for them. At the hospital then, the emergency department will begin taking care of the patient, managing the patient, and depending on what they find wrong with them, they'll involve more specialties and manage the patient. So that's a little bit about the EMS system. It is much more than just seeing an ambulance going up and down the road, much more than lights and sirens. We're pretty highly highly trained professionals. We do a lot of different things in the ambulance. We do a lot of different things outside of the ambulance. So when somebody says, what is EMS? It is a hard thing for me to give a 1 or 2 word sentence for. We are more than just emergencies, because we also do non-emergency stuff. We do medical, but we are also part of the first responder community. Regardless though, we do serve. When we help people and we try to make their bad days a little bit better. And if you remember that going into this field, that we are a service and we serve our patients and go into it with a servant attitude, you'll start off on the right foot.